The situation, of course, taking place in the Democratic Republic of Congo, where they've just declared the end of the 12th Ebola outbreak. And to tell us a little bit more about that situation, we now cross to our chief editor, the chief editor of the Kinshasa Times online, Aimé Zomveni. Aimé, thanks very much indeed for joining us. Welcome to the program.
Thank you for having me.
All right, so I've got to try and remind myself which part of the DRC, because this Ebola often switches from east to west. The last time we spoke, I think it had just been working in the eastern part of the country. Is that where it has now been declared an end?
No, in fact, the 11th outbreak happened in the western parts of the DRC, a place known as Mbandaka in the former province of Equateur. The 12th outbreak, which just has been ended, happened in North Kivu, which is also home to a lot of instability, which is now eastern DRC.
All right, so what are they saying? When they say it's ended, a period of time must have passed, hasn't it?
In fact, according to the WHO standards, you have to count 42 days from when the last patient was released from the health facilities. These are known as ETUs or Ebola Ebola treatment centers, ETCs instead. So when the last patient is released from an ETC, you start counting from that time 42 days. So in this case, that was the 7th of February. And if you count 42 days without any new case happening, then you officially declare the outbreak as ended.
Do we know how many people died in this last wave?
Well, unlike the previous waves, which claimed many lives, the latest only claimed 6 people out of the 12 infected people as reported. So the case fatality rate was quite high, 50%, but still if you count the number of people that lost their lives to the disease, it's only 6 people.
Why is it that the country is now better able to manage this disease? Is it partly because of vaccinations?
Well, I think the better performance would be attributable first to the fact that the DRC, I would say, is sort of like battle-hardened to combat Ebola now that the disease has recurred in the country for 12 times. Secondly, a vaccine was trialed in West Africa. That vaccine seems to be quite effective. So it has been used widely in Eastern DRC. And the third reason, and maybe the most important, is that from 2019 to 2020, a randomized clinical trial took place in the DRC. And that clinical trial culminated in 2 drugs, 2 therapeutics proving very effective against Ebola, which are called the Regeneron and the MAB114. And those therapeutics have been FDA approved in the United States. They prove very effective, and they have been used in this case on a compassionate base because they are not as yet approved in the DRC in order to contain the disease. That's what has helped the country better manage the outbreak this time around.
And I suppose there's always great relief when it doesn't cross the border, which is always a threat.
Indeed, the response team was able to contain it. Actually, it's where the latest outbreak happened is exactly where the 10th outbreak happened. This is North Kivu in the area of Biena, Musienene, and Butembo. So the response team was still conducting surveillance activities there. So when the latest outbreak happened, it found the Ministry of Health personnel already there. Not only that, but also with appropriate drugs to tackle the disease.
All right. So the health authorities, as you said, this time around, really on top of their game. They've seen all of this before, and the protocols kick in as soon as one case is found.
Exactly, that's what has happened. So it's simply the system that was there that took care of the 11th of the 10th outbreak, which was immediately reactivated. And then the logistics was in place, moving drugs from Kinshasa to Eastern DRC, and immediately trying to respond to the outbreak and containing it so that it was not able to cross over to neighboring countries.
And I guess one must always remain vigilant. I mean, this was the 12th outbreak, so this is something that the DRC is constantly going to have to be conscious of and prepare for.
So what happens is when an outbreak is declared ended, you have what they call post-outbreak surveillance period, which is 90 days. So the response team does not immediately pull out, it stays there for another 90 days in order to make sure that in the event there is any resurgence or in the event there is a case that happens, they will immediately try and respond. So that 90-day period effectively starts today. And as I've said, given the existence of effective drugs, vaccination, and the presence of Ministry of Health staff there, if there should be any new outbreak happening there, the Ministry of Health is quite confident to contain it.
Have the health authorities ever been able to find a reason why the DRC is particularly vulnerable to this disease?
I think it seems as if since 1976, when the first outbreak occurred in the country, it seems like this is a disease of which the reservoir seems to be in animals, and it's not human. And the DRC is a tropical country. People love eating bush meat. So you have different strains of the virus circulating. And at least now, even though the country is prone to that disease because of the presence of many different types of bush meat here, I think with the presence, the availability of effective drugs and vaccines, at least now, even if there's another outbreak, the country will be better prepared to respond to it. And also the country has ramped up its research efforts with the help or the assistance of partners such as the US National Institutes of Health or the Belgian Institute of Tropical Medicine that are now partnering with the country's Institute for Biomedical Research known as the NRB. So there are better coordination and partnerships now that will help the country better respond to Ebola outbreaks.
All right, it's great news, but as you say, let's be cautious and let's see what happens in the next 90 days. But it does seem that these vaccines and working in combination with a more efficient response, that this is a disease now that can be managed. Aimé, merci beaucoup, mon frère. À bientôt.
Je vous en prie. Au revoir.
Thanks so much indeed. All right, that's a DRC journalist, Aimé Zontveni, speaking to us about the DRC, which has now declared the end of its 12th Ebola outbreak. 90 days, though, of monitoring just to make sure that it is behind them.